Remaining probable cases 11. Cumulatively traced close contacts 733,733. Close contacts that remained under medical observation 7,873. According to reports from provinces, cities, and Xinjiang Production and Construction Corp, new asymptomatic infections 20. On the day, none of them were transferred to the category of confirmed cases. 12 were removed from medical observation, including 3 imported asymptomatic infections. Though the asymptomatic infections that remained under medical observation 989, including 112 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,513, including 1,039 in the Hong Kong SAR, 45 in the Macau SAR, and 429 in the Taiwan region. On May the 1st, new confirmed case in the country 1. That was the lowest since January the 16th in 28 provinces. In the Xinjiang Production Construction Corp, for 14 consecutive days, there was no new confirmed domestic cases. Starting from today, the emergency response alert level was brought down to 2 or even lower. The first day of May Day holiday, in certain tourist destinations, there were some crowded situations and some tourists were not wearing masks. We suggested that we must stagger our visits to the scenic spots, wear masks, pay attention to hand hygiene, pay attention to temperature changes, and keep unrelenting focus on personal protection equipments. According to latest report by WHO, the pandemic is raging in 230 plus countries and regions and territories. The average daily increase was above 600 cases across the world. In Serbia, National Defense Ministry has awarded and confirmed the Chinese emergency medical team the highest level of national respect. We will collaborate with the international community in this joint fight against the pandemic. Now we'd like to take questions from the floor, and please identify your organization before you ask the questions. Journalist from the first row on the right side, please. Thank you. With the CCTV. According to the reports of Jiangsu province, cumulative provincial cases, 600 cases plus. There was 0 death and 0 health worker infection. So what were the decisions and the plans and the measures adopted by Jiangsu province? Deputy Director Zhou Minghao is taking the question. Early, quick, and stringent measures were adopted. First, we made very early interventions and decision-making. On the day we heard about the Wuhan epidemic information, we sent the alarm bell. We requested all the hospitals to enhance the monitoring. The identification of the first case led to our decisive decision of closing the places with public gatherings and suspended unnecessary public gathering activities. Later, we have suspended the interprovincial highway coach transportation. So that was the first measure, early intervention. Second, we have set up 3 lines of defenses. First, at the ports of entries, we set up working groups. There were dedicated shuttle buses to take the passengers for the mass quarantine. We paid special attention to the disinfection, ventilation, and personal protection equipment on these shuttle buses. We've set up dedicated channels for the transfer of the inbound travelers. The second line of defense is in individual organizations and communities. We've innovated way of work, leveraged big data plus grid management plus the submitting of health declarations and mass engagement. One police officer at community, one cadre at community level, one volunteer, and one grid manager will coordinate the service provided to key risk groups. At the community level, the inbound travelers, those who are in home quarantine or mass quarantine were well managed. The last line of defense was in hospitals. We enhanced the monitoring by fever clinics, the monitoring of atypical pneumonia, severe pneumonia, and COVID-19 triggered pneumonia. In particular, we focused on the NAT tests of the fever patients and surgery patients to identify cases at an earlier time, also to identify asymptomatic infections. And the last measure was stringent practices. From the identification of the first case of asymptomatic infections, we began to treat it as rigorously as confirmed cases. We intervened at an earlier time for the close contacts and asymptomatic infections. We used the first 2 days of mass quarantine observation data as the basis for later judgment and practices. And then we intervened even earlier to the flights they took when they arrived in the province to make a conclusion on the potential close contacts. Next question, please.
Thank you. With Economic Daily, we found that in Jiangsu province, the cure rate was 100%, and the eldest patient treated was 97 years old, and the proportion of severe cases and the critical cases were very low. So we would like to know what are the experience that you can share in this regard. We will have Dr. Huang Mao to take the question. Thank you for your question. Well, we focus on two things. First, we try to increase the cure rate of the severe cases, and the second, we try to reduce the incidence of the severe cases. In terms of cure rate improvement, the question for us is to have highly efficient medical resource allocation to provide the best quality services and care. So we have had the tiered diagnosis and the treatment approach at the provincial, city, and the hospital level. We have the expert teams. With this approach, every severe case can be treated with the best experts in our province. The city experts working at the designated hospitals, while the provincial experts will conduct the concentrated consultation for the patients. And in the hospital, the key experts or medical doctors will compose the expert team, and we provide the best capacity possible to treat the cases one by one. This is, I think, very important. You know, there are many drugs and therapies, but what is the most important or appropriate one for the specific case? I think we have adopted this personalized approach, and this is the key to success. For every severe case, in terms of the medical resource support and the development of the therapeutic program or protocol, we offer the best we can. That's why we have done a lot in treating the severe and the critical cases. And secondly, how to reduce the incidence of the severe case? I think the answer is early detection. That is, early finding, early detection, early testing. Then try to prevent the worsening of the cases. We had the early warning system with the clinical experts. The relevant information, in particular the risk factors, are carefully analyzed to set up the risk model for the specific indicators which may indicate that the case may have the probability to get worse. Then we will have the early intervention. So with this risk model and timely screening, we try to prevent the worsening of the symptoms, and also we provide well-targeted therapies and support to every patient. For example, previously we had the ventilation approach only for severe and critical cases, but later we found that this is also very helpful for patients who are prone to develop into severe cases. Then, in general, I think the evidence-based and the personalized approach are the key to success. Thank you. Let's continue. On the right, on the second, the third lady reporter, please. Thank you. With Hong Kong Economic Herald, internationally, the pandemic is spreading, and overseas importation has become one important source. In Jiangsu province, you have a lot of international companies and many international travelers or inbound travelers. So what are the measures that you have adopted to address this problem? We will have Dr. Wu Ming to take the question. For overseas importation, we have adopted 3 measures. First, early assessment and resource allocation. In the early days of outbreak, we assessed the risk of overseas importation and conducted health management. Starting from February the 26th, we had the daily reporting mechanism concerning the inbound travelers, and also this mechanism is dynamically adjusted based on the local spread of the pandemic. Now, except the vulnerable population like children and elderly who could not have the concentrated quarantine, all the inbound travelers are quarantined in a concentrated manner. Furthermore, we dispatched more than 200 staff to realize the seamless connection and management of the inbound travelers. We also provide the facilities and the relevant psychological support to people who are inbound travelers. At the start, we got the support and understanding from these inbound travelers. And thirdly, starting from March, we had the 2 NAT tests on the inbound travelers when they were quarantined and before they were removed from the quarantine. Also for the various vehicles the inbound travelers may take, we work together with the relevant authorities and set up a fast response mechanism. The moment we identify any suspected case, the mechanism will be kicked off, and the relevant information, especially those concerning the close contacts, have been shared among the stakeholders. Sometimes even before the close contact has arrived, the information has already been shared and appropriate measures have been adopted. Okay, let's continue. On the left, on the second row, the reporter over there, please. Thank you. With the CETV, we know that among the 8 key figures for treating severe cases and in Wuhan. 3 of them came from Wuhan, and still there are 10 experts who stayed in Wuhan when other medical teams have already returned from their missions. Could you please share with us their experience? We will have Madam Huang to take the question. Thank you. Indeed, for ICU or intensive care, it's a sound demonstration of the strength and the capability of a particular hospital. In the COVID-19, the case fatality rate is quite high, while 10 to 20% of the COVID-19 cases are severe and critical cases. Jiangsu province made various efforts. First, we intensified the resource allocation for severe and critical cases. In building the medical teams, we pay particular attention to the expertise of the medical teams. We have more than 180 doctors and nurses, representing over 60% of the total number of the staff to Wuhan and Hubei. Furthermore, we worked with the local colleagues to expand the capacity to take in and treat the severe and critical cases. We brought with us and also made financial contribution to the local hospitals to procure equipments like ECMO. Also, we had the help from the headquarters. We had the long-distance consultation with the head office. Furthermore, with the 4-1 mechanism, we ensured the high-quality treatment. This 4-1 refers to the one medical team for one particular patient, one medical treatment therapy for one particular patient.
Every half day, there will be a ward round by the expert panel and the physician to have the ward round. On a daily basis, there are 2 daily routine meetings, in particular for the severe and critical cases, the problems identified, and the possible solutions. Third, we've emphasized the 5 treatment measures: early intervention, early alarming, intervene earlier, to identify the best and opportune time for medical intervention, emphasize multidisciplinary collaboration to improve the treatment on COVID-19 patients, in particular the ones with comorbidities. For the patients with underlying diseases, we've been leveraging TCM to ensure holistic treatment. We also emphasized individualized and personalized treatment. We focused on the specific particularities of the individual patient. We also emphasized the rehabilitation treatment for severe patients. On top of the basic medical interventions, we focused on the rehabilitation, psychological health, and nutrition of the severe patients. Over the years, we've been focusing on the training of physicians for the treatment of severe cases. We enhanced the standardized training for the treatment of severe cases. We've also set up multidisciplinary lines for the treatment of severe cases to ensure among all the patients a consistent standard of treatment can be ensured, which has shown its effect in this medical team assistance to Hubei province. And this alliance is now joined by more and more health professionals. Next question goes to the journalist on the second row on the left side. Thank you. With the CNS, Jiangsu province has sent 2,800 plus medical workers to Wuhan and Huangshi. I'd like to ask the head of the EMT, how did you ensure the unity and cohesion of such a big medical team? I'd like to ask Mr. Lu Xia to take the question. For me personally, on February the 11th, I led the Huangshi team. And your question brought me back to the time of February when we first arrived at the front line. Jiangsu province sent 14 batches of medical teams, and most went to Wuhan in several severe case hospitals and mobile camping hospitals. In Huangshi, there were 2 teams sent on 11th and 24th of February, so altogether 2,820 of us went to Hubei province. After we arrived at the front line, all the members have been selected according to the national deployment. When we were making the selection on the team members, we had a high criteria of the team member selection. When the national standard requests deputy associate professors, we selected professors. So we put our standards higher even than the national standards for the team member selection. After we arrived in Wuhan or in Huangshi, we looked at the local needs and rescheduled our team into different subunits. And they then engage in collaboration with local health workers. In Huangshi, the 300 plus of us has been divided into 12 subunits. We've selected some of the interim heads or party secretaries to lead the subunits and to collaborate with the local colleagues. So in the organizational structure, we first made sound arrangements. Second, we stepped up the organizational management. All the members went through stringent training before they come to their posts. IPC colleagues have been with the entire process to ensure the safety of health workers in the team. We were fighting a critical battle at the front line. Each and every of us had the strong drive of completing our mission and bringing back each and every safe and sound. After I arrived in Huangshi on 17th of February, Hubei province convened a press conference, and on that conference I quoted a letter from a family member of team member. He said that in the adverse time, I hope when you are trying to save the lives of others at the risk of your life, please come back safe and sound. We were shouldered with the double responsibility of saving lives of others and safeguarding the lives of each and every of the team members. Apart from the organizational structural arrangements, we have been implementing the 27 provisions from the central government. Jiangsu province adopted measures to ensure solid care is provided to the frontline medical workers. Some episodes to be shared here. When we were fighting in Hubei, Wuhan, Huangshi cities, Jiangsu province designed a team badge for all the members. We know that when health workers went into the quarantined wards, they have to wear protective gears, the masks, the goggles, the masks, and the face shields. And it's difficult to identify who is who. People were coming from different hospitals and different departments, so we wrote our names on the protective gears. And our hospitals thought it was not convenient enough, so they designed a badge for us. It is a heart in the shape of a heart and has the name of our province. That was the provincial unity we have crystallized into a badge. And if you look at the Chinese character of our province, 2 points on this character, when you zoom it out, they come into the shape of the maps of Jiangsu province and the Hubei province. When I was explaining the connotation of our badge, many of the local health workers had tears in their eyes when they found what this badge was referring to. So all these humanistic care and solid care provided to us has inspired each and every of us to bring out the best in our skills. And we were trading with not only the skills, but also our heart, love, and passion. With the skills and the passion, we believe we can make the final win. So that was a very small episode showing our organization and of the team members and the care we provided them with. Next question goes to the journalist on the 3rd row on the right side. Thank you. With People's Daily. In the reports we've read, it showed that the 3 mobile camping hospitals and the management of Jiangsu Provincial Medical Team had realized 0 death and 0 infection among health workers. So what were the features of management of the team members in the mobile camping hospitals? Again, I'd like to ask Director Lu Xiang to take the question. We know mobile camping hospitals recruit confirmed mild cases. That was an innovative case in Wuhan. At such unconventional time, that was an emergent measure adopted. We've been using these stadiums or the public venues to change it into mobile camping hospitals and collect the mild symptom patients. Looking back, that practice has been proven effective in Wuhan, ensuring all those that should be admitted could be admitted. It provided 10,000 plus beds.
From Jiangsu, there are 3 medical teams who are engaged in the development and the management of the the makeshift hospitals. Among the 5th group of medical teams for Hubei, the medical team from my hospital was one of such teams, and they worked in the stadium, the sports stadium makeshift hospital. For makeshift hospitals, they take in mild cases with a very large space. It's not like a hospital. It has over 1,000 beds, and patients hospitalized are all mild cases. You can imagine the situation. More than 1,000 people all of a sudden move into this place at the same time, and they may run into various difficulties living in such a big makeshift hospital. It's like a semi-militarized situation, and the makeshift hospitals are built to prevent the potential spread of the pandemic in the society. The medical staff working in the makeshift hospitals are also put into a brand new situation, and they are faced with very different patients than the ones they used to have. Patients living in the makeshift hospitals have their own life stories, and they may are in different moods. living in this makeshift hospital. So just as President Huang has mentioned, the treatment of the severe cases is a big challenge. However, the large number of patients are mild cases, and their management is also a challenge. When we were working in the makeshift hospitals, there were many medical teams from different parts of the country. I think this is a joint undertaking. The makeshift hospital is a public place. We have a zoning of it and divided it into different zones and then different grids. By doing so, we wish to have a sound organization of the makeshift hospital. For example, we might be the medical team responsible for a particular grid with about 80 to 100 patients. And in the front line, we set up a joint party team composing the doctors, nurses, and the patients. So with such community-like organization, we can try to coordinate the work and the life of the doctors, nurses, and the patients. By doing so, we can accomplish the treatment. So with this sound organizing, we realize the zero relapse, zero death, and zero infection among the medical staff. So we have the zoning, grading, and community-like organization. We make the hospital like a community. Also, we give the patients the chances to have square downs, body exercises, and get access to health knowledge, just like a community. The communities also learn from each other among the communities. So this seemingly cold and cruel place is turned into a loving and caring community. So we are also providing such services to the community residents. We use our love and care to manage the people who live in this community, particular community. Okay, thank you. On the right, on the third row, the lady reporter over there, please. Thank you. With CCTV News, I'm from the new media. Just now, the spokesperson has mentioned that China has sent and is sending medical teams to other countries to help them. We noticed that the medical team to Venezuela was composed of medical experts from Jiangsu province. So my question is, how about the medical team in Venezuela? We will have Dr. Huang to take the question. Thank you. Yes, we flew 30 hours, 15,000 kilometers to arrive at Venezuela. We developed the term within 1 day, and we arrived at Venezuela in 3 a.m. on the March the 30th. So on the same day we arrived, we began to work. We had experts from the various disciplines, such as hospital internal infection. That's why we visited various hospitals and community healthcare centers. We had exchanges and conducted 13 trainings for the local medical professionals. Also, we conducted household visits and epidemiological service with the local staff. An old gentleman said movingly that he really appreciated our efforts in Venezuela. When we worked in Venezuela, we were really touched by the local professionals' dedication. They worked around the clock, and that has also impressed us greatly, and that's why we are also working very dedicatedly. Venezuela is the first country that practiced social distancing in Latin America or the Caribbean region, and we were told by the state leader that the country will continue to practice such public prevention measure. We also offered some suggestions, and our suggestions have been adopted by the local governments. When we were in Venezuela, we were also kindly and warmly treated. President of the country received us and expressed his appreciation to us. In the seal of ceremony, Premier of the country conferred the national medal to us. This national medal is a great honor. It is always for people who have contributed greatly to the country. So, on behalf of the government and the people, the President expressed his appreciation to the Chinese government and the Chinese people. We worked there for 2 weeks, but we would never forget our experience in Venezuela. I have kept some of the objects that we have used in Venezuela. I'm sure in the future we will work together with Venezuela to fight against the virus. Okay, let's continue. On the right, on the fourth row, the first gentleman reporter, please.
谢谢秘书长。
And thank you. With Shenzhen TV. My question is, it is important to implement the 4 earlies, avoid any likelihood of cluster cases. How did Jiangsu ensure this? I'd like to ask Director Wu Ming from Jiangsu Provincial CDC to take the question. Jiangsu Province has compiled a good textbook to inform the public. We have 15 notices on the notices to the general public related to the resumption of business and reopening of schools. We've also compiled some video clips and uploaded it online. The videos related to the resumption of business and school reopening had a hit of 80 million and plus. We've also organized the technical guidance team composed of all sectors. We've sent 16,000 person times to provide on-site guidance. 1,300 person times guidance have been provided to all the schools. In the first week of the school reopening, the CDC staff will be on site. We've also set up the standards identifying the person accountable for the health in individual organizations and schools. There is a provincial students' health monitoring system on a daily basis. We ask the schools to report the absent students because of health issues and conduct monitoring accordingly. The health institution has collaborated with the education authority to be engaged in the examination of schools, and that has been conducted for 22,000 times. In Jiangling District, Muling Street, there were many enterprises, so some words on the monitoring provided to ensure safe returning to work. 300 plus enterprises in the community and street have received guidance from the CDC staff, and our CDC staff have been patrolling all these streets and enterprises. Each day they have to walk 20,000 to 40,000 steps to ensure proper information has been circulated. Many of the CDC staff said, wow, that has been a great opportunity to lose weight. Our guidance teams have been working with the enterprises on a daily basis, guiding the employees to enhance their awareness, guiding the proper disinfection sanitation measures, and helping the enterprises to deal with symptomatic employees. Thank you. Next question goes to the journalist on the fourth row on the left side. Thank you. National Business Daily. The Standing Committee of the State Council has pointed out that the pandemic has been suppressed, but we shouldn't slacken our efforts. Jiangsu province has been quick in resuming business, which may put pressure on the COVID-19 prevention control. So what are the plans for the regular prevention control efforts in the rapid resumption of business? Deputy Director Zhou Minghao is taking the question. Thank you for your question. Yes, indeed, we are under great pressure of prevention control in the context of a rapid business resumption. We will follow the deployment from the central government to prevent imported cases and the domestic revival. We emphasize 4 earlies. In particular, only when we have a good control can we reopen the economy. We must ensure precise measures adopted in the prevention and control. In the analysis of a pandemic situation, we organize experts to follow domestic and international pandemic information. In particular, we need to pay attention to overseas Chinese students and migrant workers in other countries. The local pandemic situation must be under our monitoring analysis, which may be the basis of our adjustment in prevention and control measures. In the management of key risk populations, we will enhance the information sharing, acquire precise information from high, moderate, and low-risk regions, and inbound travelers' information to prepare, enhance temperature monitoring and other health checks. In the management of the patients, we will continue to follow the 4 poolings, ensure the daily monitoring of patients, continue with the consultation of experts, prevent the converting of asymptomatic infections to confirmed cases, and prevent mild cases escalating into severe cases, and enhance the management of severe cases. We must enhance the fever clinic monitoring, have better practices in disinfection, the screening of personnel, the accompanying of the patients, and prevent against the nosocomial infection. On the front of safeguarding resumption of business and school reopening, we must enhance the support provided to key enterprises and all the schools, improve our technical guidance to enable the proper operation of schools and businesses. In particular, the health code and must be mutually recognized to ensure safe and orderly people movement. For the schools that have been reopened, in each school in the first week of school reopening, there is one dedicated health staff on site to guide the implementation of all prevention control measures. Meanwhile, we will continue to look for the weaknesses in our prevention and control to make up for the weaknesses, improve the health monitoring emergency response system so as to promote the sustainable development of health in our country. In the interest of time, we will take the last question that goes to the journalist on the second row of the left side. Thank you. With Yangtze Daily News. First, I'd like to thank Jiangsu medical team for saving the lives of so many Wuhan citizens. Many of you have been working in Wuhan for 80 to 90 days. That was painstaking work, and you were working under great pressure. What has been the psychological status of your team members? How did you alleviate the psychological burden? I'd like to ask Madam Huang Yingzi to take the last question. Thank you very much for the question. Jiangsu provincial medical teams have been working very hard when we were at the front line, but meanwhile we were happy because behind us there were many who cared about us, and our home hospital and the commanding center have paid great attention to ensure our life can be unaffected, to ensure that we feel safe and we are safe. They even delivered the great dishes, or the Jiangsu-style dishes, to us. When we were working at the front line, we didn't have to worry because our family members, our parents, children, they were taken good care of by all the organizations, our hospitals, and our communities. So we could fight at the forefront in the battlefield without any worry. But there was psychological burden because the work intensity was high. It was an unknown emerging infectious disease. It was the early time of its eruption. There were so many unknown factors. Even as the health workers, we could have the worries of infection, and after work we had to live in separate dormitories. We didn't have many chances of communicating with other colleagues. Many of us were born in the 1990s, and among us 35% of them were young people in their early 90s, in their 30s. So many after the organization learned about this, our hospitals helped to set up a remote psychological counseling platform. When the young team members had psychological stress, they can contact the psychologist, the therapist online, and they received a lot of help, and their stress was alleviated.
Second, the anxiety may come from the uncertainties for nosocomial infection. That's why we pay particular attention to guard against the nosocomial infection. We had very strict training on the use of the medical protective devices like the protective gears, and also we set up the physical barriers like the zoning and the quarantine area. We hope that in the sound environment, we, the doctors, the nurses, are safe. Also, we emphasize the pioneering role of the CPC party members, the experienced medical workers who are usually the party members, setting up very good examples. We have the 6 medical experts who were born in the 1960s and who were party members. They were the first group of people to go to the front line. So the CPC party members are setting up very good examples. And this helps to stabilize the mood of the young doctors and the nurses. When we were working in the front line, we can always feel the love and care from the back office. I would like to add that we still have 2 doctors who are still working in Hubei province. Most of the medical team members have already been back to work in Jiangsu, so you don't need to worry for us. Thank you so much. Okay, thank you. President Qiu Haibo was working now in Heilongjiang. He worked in Hubei province for 100 days, and then he directly went to Heilongjiang province for the Suifenghe situation. So I would like to pay our tribute and appreciation to all of the medical doctors and the nurses who've been working in the province. Thank you so much. For tomorrow's press conference, we will invite experts from Huaxi Hospital in Sichuan province, and also the medical teams from Shandong province and some other provinces to come to the press conference. That's all for today. Thank you very much.